everyone. I'm Beth with GeekWire. On behalf of the entire GeekWire team, I'd like to welcome you to today's GeekWire Studios session, where we'll be talking about healthcare, technology, and how to improve the patient experience with standardizing data exchange. Before we get started, I'd like a quick shout out to all the GeekWire members today in the audience. Memberships help fuel GeekWire's daily journalism in covering the Northwest tech community. If you are not yet an individual or a corporate GeekWire member, please visit geekwire.com/membership for more information. A reminder for today, please use the Zoom functions available to you to submit your questions, and also look for useful links to be posted throughout today's webinar. It is now my pleasure to introduce to you today's moderator, Meghan Quint. With over a decade of experience in healthcare innovation, corporate strategy, data, and analytics, Meghan is a founding executive at Opala, responsible for commercial efforts and go-to-market strategy, including product, sales, and strategic partnerships. Welcome, Meghan.
Okay, so thank you, Beth, and the GeekWire team. Welcome, everybody in our audience. Thank you for joining our webinar discussion today. On our panel today, it's my privilege to welcome Nathan Johnson from Premera. Nathan is Vice President of Integrated Products, where he's responsible for a portfolio of provider and provider partnered products, in concert with Premera's vertical integration strategy. Don't worry, I'll ask him about that a little bit more here in a bit. Nathan, welcome. Thank you for joining us. And we also have Rami Rafeh from Premera. Rami is Vice President of Provider Strategy and Collaboration. He's responsible for leading Premera's collaboration with healthcare providers and other partners to develop innovative solutions that meet the needs of Premera's customers. So welcome, Rami. Thank you also for joining us today.
Thanks, Megan.
So our panel is very excited to have this opportunity to talk with you all about how much better the patient experience can be with the healthcare system functioning in a coordinated way on the patient's behalf. Opala was launched a little over a year ago, and we're obsessed with creating solutions that allow a person's information to follow them throughout their healthcare journey. So for us, that means different care sites, different doctors, patient information from pharmacies, lab tests, even changes in health insurance. So with that, we're very excited to be joined here by Nathan and Rami to talk about the impact and even the possibility of more fluid data exchange in healthcare. So let's get started. Nathan, as promised, I said I would ask you, you're the Vice President of Integrated Products. What does that mean? What are integrated products, and why should a patient be interested that Premera is developing and offering integrated products?
Well, thanks, Megan. It's a good question. Merits an answer with any non-industry standard title, the one I share today. Maybe for a little bit of context, though, on Premera, you know, not everyone may be familiar. Premera Blue Cross is headquartered right here in Mount Lake Terrace, Washington, which is where I am today. We have roughly 3,200 employees and serve more than 2.5 million members, many of whom reside in our chief service areas of Washington, Alaska, but we have plenty of membership really around the country. And the story of integrated products, it actually starts with value, how to create value for those members. And for Premera, our ability to deliver value every day is inextricably linked to providers of care. And for far too long, in my view, at least, payers and providers, we've been on the opposite side of the table. We've been in this zero-sum game, pounding fists on the table. Pretty transactional relationships abound throughout the healthcare ecosystem, but particularly between payers and providers. And so the patient, the customer, the member of ours gets the raw deal in all of that, because that transactional relationship adds layers of bureaucracy. It adds administrative complexity, and and it adds costs, makes healthcare less affordable. So at Premera, we're committed to getting closer to the point of care. And that's happening through a number of ways, both through deepened strategic relationships with some of our existing providers, as well as really for the first time, we're investing in new sites of primary care, which are exclusively available to Premera members. Our first 4 such primary care clinics have opened in Spokane. And so the team I'm now leading is charged with crafting new value propositions on top of those strategies and making sure that customers get the maximum amount of value from our vertical integration strategy, which is still early, but I'm really, really excited about the next 3 to 5 years in the way of new value we can deliver to Washington and Alaska customers. So that's the scoop. Back to you.
That is exciting. Thank you, Nathan. And we'll talk a lot more today about the value we believe Premera members will receive from some of those integrated products, and particularly from the partnerships between Premera and providers. So maybe Rami, can you tell us what has taken us so long to get data moving between providers and health insurance companies? And now that we've got a little bit of momentum, maybe you can tell us, how is that going to change the care experience?
Thank you, Megan. I'm really excited about today's conversation because it's a topic that's near and dear to my heart. We're still the only industry that's propping up fax machines and pagers. I mean, when you think of instant messaging, when was the last time you exchanged your BBM pin on your BlackBerry device with another friend or family member? You could see these things transitioning over time, yet our industry still is incredibly fragmented and disjointed and has not evolved. I think the watershed moment that we're experiencing right now in terms of interoperability is one of being able to shift sentiment, but also understanding that members expect more from not only their brands and their retail shops, but also from their health companies and insurance companies alike. And so what we need to make sure is that we're evolving and innovating over time and offering that personalization back to our customers.
That's great. Thank you, Rami. So speaking of provider and payer partnerships, Nathan, recently Premera and Multicare Health Systems announced a partnership. And I read your press release for the audience. We'll put that link in the chat here. But what most caught my attention was that this partnership has set out with the goal of keeping healthcare costs flat, completely steady for 5 years. And that seems very ambitious to me. I won't say crazy, but definitely very ambitious. So maybe you can tell us a little bit about how that partnership came to be and why Premera and Multicare and everybody involved with creating this partnership believe that that's possible.
Well, I'll say in fairness, it is a bit crazy, especially if you look back at decades of healthcare costs far, far exceeding the growth of our economy and our family budgets. And this actually started over 5 years ago. It was an exploratory conversation with a provider partner, of which we have many over years. And initially what we produced is a commercial insurance product. And today that product's live in market in several geographies. It's called PCare, serves a little more than 4,000 members. But we got to talking because beyond those ambitions around a particular product, we had tens of thousands of Washingtonians that go to multi-care facilities to receive care and are also members of Premera. And we were wondering, is there something special we can do for these folks, something that would add value to them? And this brought us to the chief member pain point in healthcare. It's the one all of our research points to, and it's pretty basic. And there's no real redeeming qualities to it. To be honest, healthcare is unaffordable for many. It's increasingly unaffordable for families and for employers that purchase the majority of healthcare coverage still in this country. And healthcare costs, they do continue to grow faster than the rate of inflation, faster than GDP, faster than most employer and employee budgets alike. And so we got to thinking, is there something ambitious is the word you used, even audacious we could do to tackle this problem? And why can't we stop unsustainable healthcare trends in their tracks. If you have the right payer, the right mindset, the right provider committed to similar things, why couldn't we do zero trend, as we call it, for 5 years? And that is holding costs flat, in this case for over 36,000 people to start from this year through 2025, which is, again, a little crazy when you think about it. But we're actually, this is a matter of a payer and provider getting on the same side of the table. Less fist pounding, more working together, more collaborating at the point of care to provide a better experience that's more seamless to members naturally, but also one that commits vocally and loudly to the market to hold those costs flat for 5 years. Now, it took a level of trust that did not exist prior and deep transparency between both business models to reach this point. And it's going to require that moving forward over the course of this 5-year agreement we've reached to maintain performance. But a huge component of that story, and I realize we'll dip further into this in today's discussion, is data. And making the data and performance and understanding of the business model far more transparent between the parties. At one point, our partner said, no data, no risk. And that's frankly understandable. If we want providers to tackle this number one member pain point with us, they have to have the right data, the requisite data at the fingertips. And we were ultimately able to do that in this case. And now the future is in front of us and we're managing to it aggressively. And this is an example of payers and providers, at least in this market, working exceptionally different together. And I'm really excited about where it's headed.
So maybe to pull on that thread a little bit more, you mentioned that this is a really good example of a payer and a provider getting on the same side of the table, ultimately to serve a mutual customer, right? I just use the word patient, but I know Premera thinks of their customers as members, but really we're talking about people, right? We're talking about people that are in a healthcare context. Mentioning data, Rami, maybe you can tell me a little bit more about, from your perspective, why is healthcare so different than other industries in terms of serving their customers, whether they be patients or members, and in this case where you have stakeholders with similar customers, with the customers who are the same people, why is healthcare functioning different, or what needs to happen so that healthcare can serve up a better customer experience, more choice, better quality, cost that's actually sustainable, for example? That would be nice. Can you speak to that a little bit?
Yeah, I think we're going through it right now in the pandemic, right? We've seen, first and foremost, our healthcare system failing us. And we've seen frontline workers really holding the line and making sure that we are out there and representing and putting our best foot forward. And collectively, Healthcare 1.0 has been about asymmetric information, which is very adversarial in nature, as Nathan had mentioned. It's about leverage. It's about zero sum. And I don't think that that's the healthcare moving forward. Healthcare moving forward is one of member centricity, customer centricity. It's one of making things simple, easy, and affordable. And in order to do that, we all need to be talking and collaborating together. It's not zero sum. And so when you think about customer sentiments has shifted in other spaces like retail, and our expectations are even higher in other spaces, that's going to carry through to healthcare. And when you think about the things in terms of your family, your friends, if you're not a patient, you will be one day. And once you put that is the greatest humanizing effect out there. And when you're in that aspect of things, I want to be the recipient of good functioning healthcare that is affordable and doesn't rely on my own networks or faculties at my most vulnerable state, whether for me or my family. And so I want to make sure that I'm the recipient of that. And for that, anyone that's experiencing healthcare should have that level playing field.
Yeah, I love that. I was mentioning at the beginning that Opala, we're really thinking about how we can help patients take their information with them at all their points, all their touch points in the healthcare system. And Right now, it seems like the burden is on the patient to do that themselves. And not only to bring their information with them, but to figure out what information they should be sharing with this particular doctor at this visit, or with the pharmacy, or with the customer service representative they're talking to. And to your point, that not only doesn't really seem fair to put that burden on the patient, but it's also probably not the best person for the job, right? Somebody who's in pain or afraid, doesn't understand how the system works, not necessarily the best person to be doing that on their behalf. There should be a better way. And we've seen this work better in other industries. I appreciated a question we got from the audience about the credit industry, and how when it comes to credit, you, the consumer, can see all of your information aggregated, and you can dispute it if it's not correct, because it is your information that's going to be shared with every lender you see. So is that what you're picturing, Rami, that if we could have this system where all of a patient's information is aggregated, and then all of that information is available to everyone who needs it for that patient? Is that really the end game here?
You know, it's interesting you mentioned that, because I also look at related worlds here, and as insurance companies, we're often called the payer. And so when you look at finance or fintech and other startups in the space, you look at the disruption that's going into fintech, and you think about things like peer-to-peer payment platforms and so on and so forth. The amount of information, look at Venmo, look at other peer-to-peer platforms, the amount of information that people are willing to share online openly and honestly it's astounding. And I think that comes with trust. They know that data flows at the speed of trust. If there's any type of, to your point, bad charge or a charge that you want to dispute, you can do that and have resolution. I think that in healthcare, we have a lot of opportunity to improve. And part of that is around data flowing at the speed of trust.
Mm-hmm. So when we think about the benefits of this more real-time, broader sharing of data, how do privacy considerations play into this? Obviously, we're talking about sensitive information, private information. What are the privacy implications?
Well, when you look at things, the regulations are helping actually spur innovation, right? And I look at in previous roles and understanding medical regulatory compliance, being part of a regulated entity. I think anyone that isn't in healthcare and is or new to healthcare is trying to understand those regulations. But just like Nathan had mentioned about partners at the table with our provider community, our regulators are also at the table, and they're also looking at moments of leadership and asking us to consider what would these mandates or other regulations on us help spur innovation here in spaces that we've been frankly very slow to innovate in, and I'm talking industry wise. Mm-hmm. And so my personal heroes back in the day, Farzad Mostashari, Todd Park, both very successful in their private careers, went to government to make sure that they are helping advance healthcare in the country. And I'd like to consider that we can carry those influencers forward and use their time in government as an opportunity to help spur innovation. And even more recently, SEMA and CMS. And so when we take those and help apply it back to our business problems, that consideration actually helps us in terms of translating business requirements and then ultimately executing on those. Not to be very jargony, but we really need to make sure that we're sticking the landing and taking those mandates and regulations, implementing them effectively, and also having advanced conversations with other partners at the table, like Nathan and Multicare.
That's great. So from your perspective, do you feel like regulations are actually, you said, spurring innovation? They're maybe breaking some of the stagnation that's been in place for a while?
Well, I'll tell you one thing. I studied interoperability over a decade ago as part of my graduate school programming, and not a lot has changed in that time. I remember Blue Button being part of Vista and the VA, but outside of that, I haven't really seen a lot of, to your point about mobility and portability until this summer. And so, you know, as industry, we're going and we're saying this has been a very much a watershed moment. And now we have multi-year roadmaps as a response and looking at things, well, what if we reimagine these opportunities as one of a competitive differentiation, but most importantly, one of a great member satisfier? And I don't think we've had a lot of those conversations in the past because we're just looking at holding the line, frankly.
Mm-hmm. So, you know, you're mentioning that now we're getting payers and providers, same side of the table, caring about the mutual customer person when they're a patient. Nathan, maybe you can talk a little bit about how do you make this work? So, you know, we had an audience question specifically. You're mentioning the importance of trust. We had a question from the audience about data governance, you know, and I'll throw in there accuracy, that sometimes it's not just lack of trust because of, you know, relationship things, but sometimes the data accuracy or the data timeliness also causes lack of trust even in the data. Can you talk a little bit about how you are working through some of those challenges in terms of sharing all the data that multi-care might need to be successful under this new partnership?
Sure. And there are plenty of challenges. Just building on Rami's theme, what I really love about the present moment is the healthcare ecosystem really had made data blocking and data siloing the competitive axis. And because of the federal government in particular getting very serious around interoperability mandates, data blocking, moving forward, I think the competitive axis is about to shift. Getting back to your question though, on partnership, you know, I think the first ingredient isn't really a logistical one, it's a human behavior one, and that is empathy for members. Empathy for the person, in our case, that pulls out the card out of their wallet that has Premera's insignia on it and seeks to obtain healthcare access. And in the case of the multi-care Premera discussion, that's something we shared in common from the very beginning. It just so happened that we had this pretty significant overlap of patients and members, as we think of it, where we could do something pretty awesome. But then the trust building that occurred, and trust is the currency, I think, of the new healthcare ecosystem, if you don't mind me saying, not to be too cliche here. There were several major ingredients in that. The first and maybe most obvious is time. I think building trust among very different players in the healthcare ecosystem is a significant time task that's in front of us. And so while I think we're at an inflection point and I think things are rapidly accelerating at the moment, so maybe it doesn't give us years and years to build trust, I think trust building cannot be a skipped step. A component of that, or a second component, I suppose, is actually coming to understand with some depth the respective business model of the player you're interacting with. In our case, it was an exploration of our values, the mission that existed within the respective organizations. And then only after that, those two kind of prerequisites had been defined, then we got into the understanding of what particular data elements are necessary to enable such a bold objective of holding costs flat for 5 years. And we went through a very thorough, very vetted process. Obviously, maintaining the security of data is crucial to this and a crucial step in that process. But where we landed for both organizations was a level of mutual data sharing that had never existed between our parties. But data sharing, not just to the benefit of business objectives. Let me be clear, this is data sharing that emboldens a radically different clinical experience as well. There are so many gaps in payer data or insurer data. There are as many gaps in provider data. And this new world of interoperability, I think its biggest benefit actually isn't cost. It's the experience of healthcare and the quality we can deliver in that experience over time. So that's kind of how I would start to address the question. I would just also add, and Meghan certainly didn't ask me to say this, but Opala is playing a big role in helping us deliver an interoperable data solution with Multicare and build one that can scale to other partners effectively. So that's a really important ingredient, not just to have willing and capable partners, but to have other supporting players help make it happen.
Well, thank you for that, Nathan. And it's a nice lead in to where I was going to go next, which is, we can sit here and talk about how great it would be if a patient's entire health history was aggregated and available. But the reality of that might be slightly different. And so, Rami, maybe you can tell me, do doctors or clinical staff want all of a patient's data? And is it manageable or even reasonable to think that, if the burden's on me, the patient today, if I were to bring in this giant pile of all of my information, or maybe I've got a thumb drive or something, I'm like, it's all here and I'm so proud. Is that even reasonable that given today's care models that could be used or would even be helpful?
The question I would ask is, what's the alternative, right? And the alternative is referring to Google and doing your own work anyway and getting a lot of misinformation out there. And so I think, and not being a doctor or a clinician myself, we'd have to ask our provider partners. But what I would ultimately say is, in a situation in which we're empowering members and our customers and patients alike with their own knowledge, then hopefully we could go about these behavior modifications in some cases, or looking at chronic disease management in other cases, or just frankly getting our directory solutions accurate. I mean, this is table stakes now. And so when we're talking with our partners out here, we're looking at richness, accuracy, and the ability to syndicate the data. And one of the most formative moments recently in my career has been market research, getting outside our four walls and talking to people and hearing from one of our members and saying that they took off of work, called 14 providers and was unable to get an appointment. That for me was like, we got to do something about this, right? And so when you're talking about data and member experience and you're talking about, oh, here's my medical record and here's your claims experience and here's the bill that you're paying, I'm talking to you also about, can I get an appointment? And it's not, and especially in the pandemic right now, knowing that there's virtual care, there's brick and mortar care, and there's everything in between, we have to make sure that that member experience is streamlined in a way where you don't have to rely on multiple sources here to get accurate information, but also to access healthcare in an efficient and simple way. So for me, it's threefold: accuracy, richness, and the ability to syndicate that data based on my terms. So I'm comfortable sharing with my doctor, my pharmacist, and maybe a coach, whatever I define that coach being. But I may want to put restrictions on my data being shared anywhere else. Well, those are the conversations we should be able to have for members that want that bespoke option based on their preference.
Mm-hmm. Yeah, and it is exciting. You mentioned earlier that, it's not a technological barrier, right? This kind of data syndication occurs and these permission models occur in other industries. So it is possible. It's not, there's no technological barrier. It really is about these partnerships and alliances and people willing to innovate and solution on behalf of patients. So thank you for sharing about that. So Rami, how does Premera measure an improved patient experience? What does that mean to Premera?
We have CSAT, or customer satisfaction scores. We also have our net promoter scores, like any other healthcare or company out there right now measuring NPS. But I would also look at the qualitative measures out there and understanding sentiment as well. And so, as you can imagine, if you're looking for a provider or getting access to healthcare, and you're like, well, I don't want to just go off a zip code here. If it's on a filter or a drop down, that's not meeting my need, right? And so my need might be education, or maybe a subspecialty, or maybe I want a provider that looks like me or acts like me or understands my shared experience or my background here. So it's not one of just a zip code search anymore, or a gender search, or a specialty search. It's so much more. And that qualitative aspect of things is what a team-based approach should be like. I refer to some of the work that comes out of UW Ames around behavioral health and collaborative care. And, that is incredible work around team-based approach and not just a transactional relationship. And so these are tenets that I hold to be true, and I hope we're able to carry them forward as well.
Yeah, so you mentioned, or we were talking earlier about the importance of consumer choice, and it sounds like you're talking a lot about using data to better empower patients to have more choices and to better align their healthcare with their own preferences even.
So it's not about having like a Cheesecake Factory menu's worth of choices, because I think that could get overwhelming very quick. I think it's about getting results back that are customized based on your need. So if you go to a restaurant that has a fixed menu, right? You're basically saying, here is, I'm paying for an experience that someone is going to give me a very limited option, but I know that the quality is there, and hopefully the experience and the ambiance is going to be there to match. And not, as you can imagine, I'm thinking about food right now because we're almost at lunch here on the Pacific Northwest. But when you start thinking about customization and options and thinking about, what's going to be true moving forward, it's around preference. And that preference is what's going to differentiate companies, especially healthcare companies.
That makes a lot of sense. Nathan, earlier you'd mentioned that the pandemic has changed some things for the healthcare system. How have consumer expectations changed?
Yeah, boy, I love that question, and I'll try to be brief in my sentiments here. I have a few thoughts. Backing up a bit, I think, and maybe this has long been forecasted, so this could be the boy crying wolf, I suppose, but there is a tidal wave of healthcare consumerism coming, in my opinion. And I actually don't mean the variety that we heard for 2 decades around high deductible health plans and HSAs, although that certainly plays a role for many employees, and it's been a good benefit design for some. I think, unfortunately, so much of that so-called consumerism choice was inserted in a world where there was still no transparency around relative price and quality of services. So I discount some of the consumerism features of those earlier gestures. But I think interoperability and transparency, 2 themes we've hit on today, they're changing the rules, and it's lowering the threshold and barriers of entry for 2 parties primarily, or 2, I'll split them into 2 domains. Both institutions of healthcare committed to rapid change and innovation, but as well a vast innovator startup community that's also looking to disrupt and drive additional value that sometimes the slower movers are not capable of doing. I think the prize is going to go to the most self-disrupting, value-creating brands in our ecosystem that can tackle these problems of care delivery and costs in a very human-centered way. Just to give an anecdote, Premera, prior to COVID, if we can think back that far, it seems like a generation ago at this stage, but a mere less than 2 years ago, when we looked backwards, about only 2% of our entire membership base had used any form of virtual care in the prior 12 months, 2% out of 2.6 million. So a relatively small kind of drop in the bucket. It was just months later in the COVID onset where we saw 30% of all members in Premera's vast national membership had utilized some form of virtual care. More than half of all behavioral health visits were being delivered virtually. And now those numbers have fluctuated a bit as things have evened out nationally and within our own Northwest setting here. But the point being is, I think for many, I'll say even for my own family, which really only was forced down the virtual care channel, believe it or not, with the advent of COVID, I think personal preferences, family preferences for care delivery have permanently shifted. And a shift that would have taken probably another, I'd say 3 to 5 years at least, happened virtually overnight. And I think consumers have generally been drawn to low friction, high convenience transactions across other industries, especially when the value prop is actually transparent to them and the price is somewhat transparent. But I think COVID in particular has permanently altered the trajectory of consumer expectation for healthcare convenience and delivery modalities. And I think it's actually just the tip of the iceberg for what's coming. And certainly that's something we're processing, of course, within Premera, but many healthcare players are on the provider side, in addition to insurers. I'll say, I think it's a very good thing to give consumers more and more station, more and more agency over their healthcare. And I think if that forces adaptations and changes within the healthcare ecosystem, it can only be for the better, because we've dealt with something, I think, relatively lackluster and gap-ridden for long enough. So I'm quite excited. I'm disappointed it took a pandemic, a worldwide pandemic, perhaps, to turn the heat up, so to speak, on all players. But I think it's time to leverage it. And I think in combination with things that are happening, again, in federal regulatory and policy environments, we're really at an inflection point for consumers, hopefully a positive one.
So certainly one of the things the pandemic revealed, many of us knew this was the case, but unfortunately many didn't, were the massive inequities of our healthcare system. And we have a question from somebody in our audience. As we think about interoperability, are there people who will benefit more than others from this investment in data fluidity? What do you think? This could be for either of you, really.
I was going to defer, Rami.
Okay.
Well, when tying in, when we were talking about data, we're also thinking about areas like race, ethnicity, language, and cultural data as well, to create that bespoke or customized preferences for members and their needs. But also from a patient perspective, I could tell you, I grew up without health insurance. My parents were small business owners, and I was chronically sick. And so I kept on remembering. In fact, my first memory was probably around first grade, where I remember being sick and wondering if we were going to be able to afford the medicine that was going to help me in that case. No 6-year-old should have to think about that. No family should have to worry or think about that burden, but also understanding there may be cultural norms out there as well that may go into patient preference. There may be other factors that people feel comfortable speaking in other areas, and in some forms they may not be. And so Nathan alluded to it before around empathy. And I think we need to get incredibly good at empathetic, not only leadership, but also understanding our preference, and again, reinforcing the fact that we'll all be patients one day. And so you want to be the recipient, if we're not already, be the recipient of that system that just works for you.
If I can add to that, I think there are unique data challenges in many sectors of healthcare. We've focused on payers and providers, acknowledging others as well. But some of us are better at collecting certain data elements than others. And one of the things I'm hopeful about, more from the exposure side of the question you asked, is as payers and providers get more and more serious about doing work together and more integrated in their tactics and their data sets and such, I think it's actually going to help us address some of the gaps, including gaps that most payers have in the way of race and ethnicity information in particular. And I think it would be really a huge disservice and almost criminal, though, to stop there. I think we've had a lot of exposure points to the questioner's premise, perhaps, around inequity, and COVID has only magnified those further. I think, and this just builds on the theme Rami led with around empathy, I think empathy must force action and things done differently. And I'll take an optimistic turn on the question. I actually think interoperability payer-provider partnerships built on some of that data-fueled innovation can do a great service in addressing some of the rampant inequities that exist within our communities. But it's going to take leadership, it's going to take risks, and it's going to take self-disruption to pull it off. And I think for Premera's purposes, we're committed to an enterprise focus on driving improved health equity, both within our plan, but in partnership with Blues plans across the country, which I think is a weapon in the arsenal that's unique to Blues plans, actually, and something we intend to leverage.
Well, certainly I hear from you both that you are not underestimating the challenge of this work. But if ever there was a worthy cause, man, this sure seems like this is it. So, in the last few minutes here, maybe starting with you, Rami, paint a picture for us, like in an ideal world, for those folks that are on the call who maybe aren't doctors, they don't work for a health insurance company. If we really are on this tidal wave of consumerism, as Nathan said, that all of this change is coming, the dams holding back the data are breaking open, and we're going to get data flowing, and the right information will be available for the patient without them having the burden of bringing that information forward. What can healthcare consumers expect over the next 5 to 10 years? How will that look different to somebody who's going to see a doctor?
Well, I look at also, again, related world and looking at the finance world and fintech. If you're able to take your debit card and go anywhere around the world, arguably speaking, and access your own banking information, whether it's at an ATM or just logging onto a website, you should be able to do that with your healthcare data, and your data should be portable. So 5 to 10 years, taking an optimistic approach, it's not going to take that long to make your data likely portable in that aspect of things, but then actioning that data is going to be the next hurdle. And so for me, I hope as an industry, and this isn't a hospital system or insurance specific and everyone in between, there are other players out there like pharmaceutical companies, and there's other areas like care coaches, and the spectrum is large. But I don't want to be just a number to a plan or just an email to a distribution list. I want to be the recipient of a system that works and is a relentless advocate for me, my family, my friends. And so I think we tend in healthcare to think of things in populations, high risk categories, or looking at young and invincible populations and everything in between. I think we get better at being individualized and being able to look at your experience and your preferences and bump that up. Over the next 10 years, I hope we get really, really good at that, and then start having more conversations around health equity. And I don't think it's going to take 10 years to get to that point again. But when you start thinking about that preference and bumping up all these other spaces that we had mentioned before around data and trust, I think that that's where the magic happens. And I'm really looking forward to it.
Yes, as am I. Nathan, final thoughts to add. I know that you have a large young family. How do you imagine healthcare changing, the experience for patients? How would it look different for a family like yours or a family different than yours? What do you expect the experience to be for a patient 5 to 10 years from now?
Well, first off, sign me up for Rami's system. I almost want to ditto and drop the mic because that was compelling. And Meghan alludes to my family. It's a large one. We have 6 kids, my wife and I do, which are keep our lives full and happy. But it also means we get to use the healthcare system quite a bit, both bringing them into this world and then keeping them alive. And so I guess let me try to personalize the question, appreciating I have such an advantage, like many of us do on this call today, of knowing healthcare or knowing things about healthcare that help us navigate, and appreciating there are so many that don't. But boy, would I love to access healthcare regularly without paper. Let's start there. Rami addressed the faxes and pagers sentiment a moment ago, but we have still Byzantine old tech at the heart of so many healthcare transactions. Who bears the burden ultimately? Yes, there's administrative cost, of course, within institutional interests, but it's the end user. It's the consumer that bears the ultimate burden because they're paying for it at the end of the day. So boy, I'd love to have a healthcare experience that resembles basically every other experience I can manage to today that doesn't involve me filling out paper. And that could hopefully leverage data and discovery about me that I permission to various health systems or payers to do the work for me and allow the providers serving me and my family and those of my family and friends in this ecosystem to actually get them focused on the clinical care and then in particular the navigation. I'll say in the recent past, we've had our own great difficulty with all of the information and resource at our fingertips, navigating a very, very complex healthcare system. So in addition to the hopefully limitation or removal of paper from this system, I think we also need highly individually tailored navigation systems that help walk people through whether they've spent their decades in their healthcare career or have no idea how to access the healthcare system. Those are two different people, right? And so our navigation approach, and whoever takes credit for it across this vast labyrinth of healthcare players, it doesn't really matter as much to me. It needs to be individually tailored. It needs to focus in on that family, on the human needs and interests that are at stake. And ultimately, I hope, building on some of Rami's themes that he's laid out, that the care delivery teams of the future start actually looking like the human system and the human needs that don't discriminate or distinguish oftentimes between physical health and behavioral health needs. We have discriminated in our institutional healthcare systems between those two, and in addition to it, stigmatized them. So something I'm deeply passionate about, and I know Rami shares my passion in this respect, is boy, we would love to interact with a healthcare system that understands us as holistic people and our family needs and social needs accordingly. For those who are interested in reading some about this, I was struck by a recent Atul Gawande article on the Costa Rican health system. No system being perfect, right? But Atul being such a wonderful storyteller, that's a story about a system that took holistic health very seriously and had an opportunity to build a system from scratch. Here, we don't have that opportunity per se, maybe thankfully so, because the Costa Rican starting point wasn't all that great. But we do have an opportunity to self-disrupt and do so with member level empathy at the heart of it. And that's what I'm hopeful for, not 5 years from now, but hopefully 1 month from now, more and more of it, because sometimes it takes bite-sized chunks to get started. So anyway, there you go. That was a bit rambly, Megan, but I hope I somewhat addressed the question.
No, that's all right. Thank you, Nathan. You know, we started out talking a bit about how the patient shouldn't have to bear the burden necessarily for these silos that exist in the healthcare system. And for everybody on the call, you know, Rami mentioned we're all either have been a patient or we're going to be a patient. So I'm sure I speak for everybody on the call here who either have been a patient or will someday be a patient, that it's encouraging to see partnerships formed like the one we talked about today between Premera and MultiCare. I'm encouraged that there's an opportunity, you know, to work for a company like Opala, where we really are all trying to get on the same side of the table, as you said, Nathan, and solve some of these problems ultimately for the patient. So I want to say thank you so much, Nathan. Thank you, Rami. Thank you to Beth and GeekWire. Special thanks to our audience. You put forward some really compelling questions. If we didn't get to all of them, I apologize. Feel free to connect with me after the webinar and follow up. For us, this is an ongoing conversation that we have every day. So we'll look forward to engaging with you more on this. I will also say that the link to this webinar will be available to you. It'll be sent to you if you registered, assuming you registered for this webinar, it'll be sent to you by email. It also will be available on GeekWire's homepage here shortly. So if you found this informative or interesting, feel free to share it. It will be available for others that weren't able to make it at this time. But thank you, everybody. I hope you have a really wonderful day.